Thank you. So good afternoon, everyone, and welcome to today's session. We are having a webinar on a very interesting topic, which is polycystic ovarian syndrome. And as everybody knows, this is the month, the PCOS month that is being celebrated. And the reason why we do this is to bring awareness and to shine a light on the on a condition that is not very frequently discussed amongst people, though it is very commonly present amongst a lot of young women. And through this initiative, we would like to reach out to as many women as possible and help them to understand and manage their condition better. To be able to do this, we work with a lot of young women with various conditions, and one of those initiatives is something called Women with Wings. We already have a large patient group that suffers from endometriosis, and they discuss and come together to address some of their problems and challenges. The second initiative that we are launching today is PCOS Support Network. And both these initiatives are under the aegis of the organization, the Patient Academy for Innovation and Research, which is a patient-focused organization dedicated to raising awareness, not only on these conditions, but many other conditions, and help people to manage their conditions better. So if I can have the introductory slides, please. Thank you, Vikas. So just a brief introduction of myself. I'm Dr. Ratna, and I'm a medically qualified person. I worked for nearly 25 years as a practicing doctor before a personal incident in my life sort of forced me to think about why patients and caregivers are not able to express their voice and are able to dialogue at an equal level with healthcare providers and are not heard. And this allowed me to go to different places and understand what patients and caregivers can bring as experiences to the table that can not only strengthen the healthcare system, but also help them manage their condition better through better communication. So I'm the director of Patient Academy for Innovation and Research. I also sit as a chair of the ISPOR, which is the International Society for Pharmaceutical Outcomes Research Patient Council. I'm the board member and founder of the Indian Alliance of Patient Groups and several other positions in my 30 years of work experience. We have two very interesting speakers today. Dr. Bandita, who has kindly agreed to spare her time from her very, very busy schedule. And we also have Sakshi, who's going to help us understand what it is to navigate the journey of a person who's suffering from PCOS. A brief introduction of Dr. Bandita. She is an MD with a diploma in reproductive medicine. She's a fellow in endoscopic surgeries and infertility and a credentialized Indian menopause practitioner, which is a very unique certification that she has. She's a consultant gynecologist and fertility specialist and a chief consultant and head in the Department of Obstetrics and Gynecology in Kokilaben Dhirubhai Ambani Hospital. She has more than 2 decades of experience, and her areas of interest are high risk pregnancy, fertility treatments, gynecological surgeries for fibroids and ovarian tumors, colposcopy, and early cancer detection. Also associated with many social awareness programs for schools, colleges, and underprivileged women, and has been a speaker and faculty for many national conferences. And her mantra, and she strongly believes in creating a holistic and unmatched care for women at various stages of life, from a teeny bopper to the golden years. So thank you so much, Dr. Sinha, for joining us today. And please help us learn more about why obesity and PCOS are interlinked, and is obesity really a concern for PCOS, and what can be done to manage these two conditions together. Over to you, ma'am.
A very good afternoon to all of you. At the outset, I should thank Dr. Ratna for the amount of initiative she has taken to create awareness. Thank you, ma'am, and thank you, your team, to connect with me for this noble cause. So today, as we all know that September is PCOS awareness month, and PCOS has like growing like an epidemic, and it is a global problem. Initially, in India, it was not much talked about PCOS, and we can say that 15 years back, people did not know about PCOS or PCOD, but then now it has become a household name. And if you open a social media or any internet services, where you will find enormous amount of information. People are seeking to know what is PCOS and whatever different conditions which is coming along with the PCOS. So it is very important that for our own country people, we should make them aware about this global epidemic condition, which is going to create much more problems later on as we go ahead. So I would like to share my PPT, if you can allow me. So although we have chosen a topic like is obesity a concern for PCOS, but to start with, I will like to tell what is PCOS. And there is lots of confusion related to PCOS, whether it is a PCOD or whether it is a PCOS. There are certain group of individuals who says, I have a PCOD, somebody has concerned that I am having a PCOS. Let me clear this fact. Like earlier, we were using medically the term PCOD, which indicates it's a polycystic ovarian disease. But over the period of time, we came to see that PCOS is not only related to the menstrual irregularity, but it is having an overall health problem. There are patients who are have even they are lean or even they are having a moderate weight, then also they can have PCOS with other parameters like hyperandrogenism, lots of facial hair, excessive hair growth. There are other psychological aspects, and then the obesity also is there. So the thing is that finally the term PCOD was changed into PCOS, which means a polycystic ovarian syndrome, which indicates that it is a syndrome complex. When we call it a syndrome, when there are multiple factors are involving, which is creating a health problem, so then we call it as a syndrome. So now we consider this disease as a polycystic ovarian syndrome, and this can range from anywhere, right from a little bit of menstrual irregularity to maybe facial hair growth, or many people do not have menstrual irregularity, but they come up with too much of acne, which is cystic in nature, with mood swings, and somebody can come up with excessive amount of weight gain, and slowly they will develop a menstrual irregularity. On the other spectrum, we can have patients who are very lean and thin, very not obese. They are so lean that you cannot think that this girl can have a PCOS. So there is a varied presentation, right from a lean PCOS to a moderate PCOS to a very obese PCOS. So today we are going to cover what is PCOS and how it is caused, and then gradually we will give a little more importance to the effect of obesity and its reasons because it is attached to the PCOS. So as the name suggests, that is polycystic. Polycystic means the ovary has multiple cysts. Normally, the ovary is designed to produce single egg in every month. And ovulation happens, the eggs comes out, and we say that the menses comes after 14 days or 15 days after the ovulation. But what happens in polycystic ovaries? The eggs are not ovulating. That is why every month these girls or females are producing small cysts in their ovary. That is why the name is polycystic ovaries. Now we are very commonly we can see that there are fat girls around us, and they may be gaining, even they are having a normal diet pattern, then also she might be gaining too much of weight, or she may be gaining very rapidly. She was thin maybe a year back, now suddenly in a year's time or 6 months time, the lady has started gaining lots of weight. Then there are individuals who are having troubled with facial hair, acne, and irregular periods. And many of the conditions, the female do not portray any kind of symptoms. And when they come, that doctor, I am not able to get a pregnancy. I'm trying for rather 1 month, 1 year, and still I'm not getting pregnant. What is the issue with me? So these all kind category of females, they may be victim of PCOS. So we should not brush it off ki, okay, weight gain happens, don't worry, do some exercise. Or if the pubertal girl suddenly starts piling up weight, we should not just scold her and say don't eat out, or don't. We need to figure out what is the problem she is going through. Or if a female is not getting a pregnancy, even she is planning to the pregnancy for 6 months or a year, and then also she is struggling with a to conceive, that means there is some kind of hormonal imbalance going inside their body, and it can be PCOS. So the alarm should be ringed that it can be PCOS. Let us investigate these group of individuals. So we all know by now that PCOS affects 1 in 10 women, and I can say nowadays what I see in my OPDs, it is 1 in 5 women in last 5 years. What I am seeing, that these group of individuals, they are having menstrual irregularity, and this is a common endocrine and metabolic disturbance. Many a time people think that if PCO is there, it is only a menstrual problem. No, it is not a menstrual problem only. It is a metabolic and a reproductive problem. So there is a lots of effect of PCOS on our general health, and overall it creates a huge amount of problem, giving rise to the symptom complex. The polycystic ovaries is a household name, as you all know by now. This is the commonest endocrine and metabolic disorder which affects 5 to 10% of females in the reproductive age group. The age group may start from 12 years to 45 years, but I am very sad to say that I have seen the youngest PCOS patient who was 11-year-old and having with lots of insulin resistance features. So the age of PCOS is also coming down. It is the condition where there are multiple number of small cysts which are in the ovaries, and we can see these cysts only in the sonography. So that is why the name has been coined as polycystic ovarian disease or syndrome. But many individuals, they do not have cyst. That does not mean that they do not fall in the category of PCOS. There are other parameters we need to investigate. This is basically characterized by spectrum of symptoms ranging from irregular periods or menses, acne, hirsutism, obesity. Hirsutism is excessive facial hair growth or male pattern of hair growth on a female body. Like a female can have facial hair growth on the chin, maybe on the chest, back. So whatever is a male pattern of hair growth that can happen in a female body, then we call it hirsutism. Then obesity, insulin resistance, and infertility. So here we can see that this is the normal ovary where eggs develop. This is the egg which is developing, and gradually this will come out, it will ovulate, and we say that it is ovulation. Now in PCOS patients, they do not regularly ovulate. So what is going to happen with these eggs? These eggs are slowly converted into small cysts. Cysts are like, you can just imagine a small bubble or a balloon. Medically, we call it a cyst. So this, see, you can see that the whole of the ovary is covered with small. In every month, the lady is going to produce a cyst, and over a period of time, the ovary is full with lots of cysts, and the size of the ovaries are also increasing because of the multiple ovarian cysts. So that is why the name has been given polycystic ovaries. So now, due to our modern lifestyle and stressful lifestyle, we don't pay much heed to our body. We don't listen to our body. We do what we like to do. Finally, we land up in the conditions which are called PCOD or diabetes or hypertension. So these are all lifestyle disorders. PCOS has been considered as a lifestyle disorder. Here we can see that this is the uterus and the ovaries which are asking for help, but we do not listen to them, and we continue with our wayward kind of lifestyle and wayward kind of eating fast food and all, which finally and gradually leads to irregularity, hormonal imbalance, and finally PCOS sets in. Then what are the symptoms? Symptoms are basically irregular periods. Most of the females, they come to us with irregular periods. This irregular period can be of any type, like a lady may have a delayed period. Initially, there may be a delayed of 7 to 10 days, then gradually 15 to 20 days. So on and so forth. And they may finally have a scanty period, or if the PCOS is becoming chronic or very serious hormonal imbalance is happening, so finally the period can stop altogether. Okay. Then sometimes we also see that these patients do not bleed for a few months and suddenly they come up with a heavy period which is not stopping at all. So any kind of permutation combination may happen due to hormonal imbalance. So there is not a single pinpoint factor which will indicate if the periods are like this, then only I will have PCOS. Otherwise, I am okay. It's not like that. If there is any kind of disturbance in the menses, and if the girl has a menarche and after 2 years of menarche, the periods are not settling down, periods are not coming at a regular interval, the girl herself should be alert and seek a medical advice. Adolescent PCOS is in a growth because lots of children, they are having they don't exercise and indulge in lots of fast food and all. So we are having lots of children, especially in the adolescent age group, who are going through PCOS and developing PCOS eventually. So it is very important that the school going girls, especially grade 5 onwards, they should be made aware about this condition, and they should at least understand what is normal and what is not normal, so that they will at least tell their mother or the teachers and seek adequate medical help in a proper time. Then comes the acne. Normal acne usually happens in teenagers and young adults. But if it is excessive in nature, then it is something we should be concerned of. Excessive hair growth, especially on the face and the body. There is a hair loss. The scalp hair becomes scanty, but there is facial hair. Why this is so? Because there is increase in the androgen. We will talk about it later on. Then weight gain or obesity, infertility, and high insulin. These are the basically routine symptoms which we see in our day-to-day practices. Then cause of PCOS, there has been a hypothesis which shows that there is an imbalance between the female and the male hormone. Normally in a female body, the female hormones are estrogen and progesterone, which is normal in quantity, and the male hormones are also present in the female body, which is known as testosterone. So the nature has given us a balance between the estrogen and the testosterone level or the androgen level to maintain our vitality. But what happens when PCOS develops? There is an imbalance between the male and the female hormones. The androgens takes an upper hand, there is increased rise in the testosterone level, and there is reduction in the feminine hormone or the estrogen in our body. So what will happen if there is rise in the testosterone or androgens in the female body? Obviously, all the male pattern things will start happening in a female body. Males do not have menses, so menses will start regularly, they will stop. Then there will be facial hair growth, the skin will become coarse, acne will come out, there will be hair thinning. So we will see that the female body is having a proper amount of androgen. That is where the PCOS starts developing. This is the main cause of PCOS, which is hyperandrogenism. That means excess of male hormones inside the female body. So this is the basic hormonal imbalance, and that's what I have described. Now the other cause or other factors, genetic predisposition. There are certain group of individuals who are predisposed to have PCOS, especially if they have a family history of diabetes or if there is a history of insulin resistance. So these category of individuals, they are predisposed to become PCOS and later on develop diabetes. Inflammation. Inflammation is commonly seen in the individuals who are lean and thin. These are the patients who develop lean PCOS, and it is very, very difficult to treat a lean PCOS because they are having lots of metabolic disorders in their body, and there is basically inflammatory in nature. Then comes the poor diet. Poor diet, which is having lack of nutrition, and even in the lean patients, if they are not eating a balanced diet, then also they can develop irregular hormones and give insulin resistance and thereby causing PCOS. So the other factors which are contributing contributing to this is the stress. As I call this, the stress is mother of all problem. All health issues, they start begin with stress. If somebody is under stress for a prolonged period of time, eventually all the hormonal imbalance will start and other factors in our body will get affected, and they can develop right from PCOS to cardiovascular diseases to any kind of other abnormalities can happen because of stress. Then improper eating habits. Nowadays, it is very common that the people, especially school going children and those going office goers or young adults, they don't take morning breakfast. So the morning breakfast should be very important, and it should be very rich in protein, because you're going to start the day after a whole night's fasting. But there is a trend that people like to skip the morning breakfast and straight away go for the lunch or brunch, you can say. Then more and more consumption of junk food, preservatives, fatty foods, and carb-rich foods, lack of exercise, and improper sleep and wake cycle. These are the factors which are modifiable factors. Suppose if somebody has a genetic thing of diabetes or a PCOS, if mother is diabetic or the grandmother is diabetic and mother is also having PCOS, there's a very likelihood that the child will develop PCOS. So that you cannot, your genetics you cannot change, but that is a non-modifiable factor, risk factor. Whereas these causes like eating, exercising, sleeping in right time, these are modifiable factors. We can make a schedule wherein we can have a regular sleep and wake cycle. Why sleep is very important? Because when we sleep, suppose if we are sleeping somewhere go to bed at 10 o'clock, then after 1.5 to 2 hours, we go into deep sleep. And that point of time at around 12 o'clock, you can say, all the feminine hormones or the reproductive hormones which are responsible for the ovarian function, they are all released at that time. So now if the girl is awake till 12 o'clock, 1 o'clock, 2 o'clock, what will happen? The brain will be in an alert mode. And when the brain is in the alert mode, all those hormones which are to be released from the brain, it will not get released. So what will happen? The brain is now not giving any signal to the ovaries. The ovary will start functioning on their own. So there is a disconnect between the brain and the ovary, what we call normally a hypophysis pituitary ovarian axis. In a regular term, in a layman's word, you can just understand the ovary is working on its own. It is not listening to the brain because the brain is not sleeping. When the brain is not sleeping, obviously the pituitary hormones, all the hypothalamic hormones, they are not coming out. So there is a disturbance in the hormones in our body, which will eventually lead to irregular periods. So that is why it is very important to sleep adequately and sleep in time. Sleeping at 2 o'clock and getting up at 11 o'clock next day is not going to help you. We need to sleep, especially by 9 o'clock or 10 o'clock, max to max 11 o'clock. We need to have a sleep schedule and get up early in the morning so that you can have some time for exercise and all. The another thing what I have observed is too much use of digital devices, especially in the night time. Children, young adults, and everybody, we can say that even in night, 11 o'clock, 12 are on their mobile devices or working something or the other. So when we are on prolonged digital devices, the radiations which are coming out, they cause problem in the brain. The melatonin is not released, so thereby causing a sleep disturbance. And sleep is very important. If somebody is not sleeping properly, she will or he will not reduce weight come what may. Whatever good thing you are eating, whatever medicines you are taking, if you are not sleeping properly, you are awake for most of the time, so there will be a very difficult phase to lose weight. It is very important to sleep in proper time. And then comes the exercise. Physical activities are very important, which most of the time we are not doing nowadays. And packaged food, fast food, they have replaced many a times our fresh and homemade foods. So these are the causes, or you can say the risk factors which has increased PCOS in the modern lifestyle. Now I will come to obesity and PCOS. More and more people with PCOS, we can see that there is an association between the overweight and obese with PCOS. But that does not mean that every obese female is going to have a PCOS. There are certain females who are genetically obese, but they are still fertile. They don't have menstrual irregularity. Here, what we are talking about is somebody who is not obese, who was having a normal weight, and suddenly she starts getting increase in her weight and becomes obese because of her lifestyle factors. Those are the potential candidates who are going to develop PCOS. So overweight and obesity are defined as abnormal or excessive fat accumulation that presents a risk for the health. The body mass index, which is 25, is considered to be overweight, and over 30 is considered to be obese. Obesity has become a global health problem with more than 6 million people dying of this hazards of obesity. Obesity is gradually increasing in children and adults in developing countries as well. And PCOS patients are normally associated with obesity, and they have more reproductive and metabolic problems, those who are having PCOS plus obesity. So how it affects us? Obesity usually polycystic ovarian syndrome, which further leads to infertility. Obesity associated PCOS results in type 2 diabetes in long term. If we do not take care of ourselves in the initial stage and we just ignore ourselves, it's just a menstrual irregularity, but it's not going to stop there. In over a period of 10, 15, 20 years, we are in for diabetes. Obesity occurs in 30 to 75% of PCOS, and there has been seen that these individuals have lots of metabolic and hormonal dysfunction. So here, this is a photograph which is showing how will you know that you are developing an insulin resistance. There are subtle symptoms which can give you a idea that I may develop insulin resistance or PCOS. Like there are individuals who have a tendency of fatigue because maybe they are not taking adequate good nutrition diet. So there is a constant fatigue, then constant hunger. So munching of too much of junk food or fast food is very common in this group. Then inability to lose weight, sugar, fatigue after meals, migrating aches and pains, upper abdominal obesity. These are all subtle indications that we may be dealing with insulin resistance. And what does insulin resistance does? Insulin is not only important for, especially to develop diabetes, but insulin resistance can cause hormonal imbalance, thereby leading polycystic ovarian syndrome. The insulin resistance can cause high cholesterol and triglyceride level, leading to increased fat storage in the body, thereby causing upper abdominal obesity. PCOS patients, they usually pile up lots of weight in their abdomen, in the core area. There may be, the legs and arms can be thin, but normally even a lean PCOS, we have seen that they have a subsequent amount of fat in their upper and the lower abdomen. And also there has been an association between the thyroid level and the PCOS. Most of the PCOS patients have hypothyroidism as well. So these are all interrelated. Does this PCOS with obesity patients face? There is anovulation because of insulin resistance. They will not ovulate. There will be anovulation. Menstrual irregularities will happen. Insulin resistance in a long term can lead to type 2 diabetes. And if they become pregnant, they have very high chances of getting miscarriages and sometimes gestational diabetes, which is very, very common nowadays. Every alternate female with a pregnancy is coming with a gestational diabetes in our hospital, we can see now. Then cardiovascular events, obstetric sleep apnea, non-alcoholic fatty liver, pregnancy complication, as I already told, endometrial cancer. Pregnancy complication, just only gestational diabetes doesn't develop. It comes with a long other factors also. They will develop preeclampsia. There can be growth retardations of the baby. There may be prematurity. So there is a series of things which starts if the lady is pregnant and she has not been taken good care about her polycystic ovarian syndrome. So this is a chart which shows that how obesity causes insulin resistance. If there is insulin resistance, it leads to high insulin level, which is known as hyperinsulinemia. This sex hormone binding globulin, thereby causing increase in the androgen level and increase in LH level. LH or the androgen is the male kind of hormone, or these are the androgens. Just to make people understand, this is an androgen which is responsible for all the male pattern disturbances in the female body. This androgen will further create a problem in the ovaries, which will lead to anovulation or absence of ovulation. There are PCO patients who are not obese, but still they have PCOS. Insulin resistance are also present in 65 to 80% of women with PCOS who are not very obese. They may be normal weight or less than that. But insulin resistance is associated with PCOS in this group also. Then insulin resistance has been shown to worsen reproductive and metabolic feature, because there will be definitely problem with the fertility issue will be there, because there is no ovulation, eggs are not coming up, then the uterine lining will not be very good. So in that conditions, there will be lots of problem during pregnancy and during conceiving also. And even if these ladies on their own, there is high rate of miscarriages and gestational diabetes and other complications. And sometimes they need aid, and sometimes they can have to go ahead and do an IVF also. If the patient is having a chronic problem of PCOS and she is not at all ovulating, and it has been a long time, and her age is also in the higher side, in those conditions, definitely they have to go ahead and take a help of artificial reproductive techniques. Then type 2 diabetes is very common. Cardiovascular risk factor is very high in PCOS patients. The highest incidence of metabolic abnormality is seen in women with marked hyperandrogenism and anovulation. Those who are of facial hair growth, hirsutism and all, they have more incidence of cardiogenic activities. PCOS is a modifiable risk factor for type 2 diabetes. As I told you, the factors which we cannot change from our side, they are non-modifiable. I cannot change my genetic thing, but I can definitely change the modifiable things like eating well, doing exercises, taking good care of ourselves. So these are the things which are known as modifiable. So why we are more concerned with the PCOS? Because most of the factors which is creating PCOS, they are all modifiable. So why not take a opportunity and control them to prevent future health hazards? So this is a photograph which is showing that not all these symptoms will be present in one single individual. There may be overlapping. Like somebody will have a polycystic ovaries, but they may not be hirsute. They are non-hirsute. And there will be a polycystic ovulatory PCOS are also there. They will ovulate, which may be infrequent ovulation. Then there are certain group of PCOS where they will be anovulatory, like they are not ovulating at all, and giving a feature of a classic PCOS. A third group can be having lots of hirsutism, lots of hyperandrogenism with a classic PCOS condition. So what I mean to say, since it is a spectrum of disease, there are various manifestations, and only after talking to the patient, doing a clinical investigations, and we come to know which medicine will suit to which patient. We cannot just have a random treatment for all patients of PCOS throughout the world. So we have to talk to them, and according to their age, according to their problems, we have to tailor made their treatment plan. So normally, how do we diagnose this condition? History is enough to find out they are going through some hormonal imbalance. Then we do a clinical examination, And there are certain lab investigations which helps us to find out the condition. And then comes the ultrasonography. But mind you, every patient of PCOS will not have cyst in the ovaries. So please don't find it very happy state if other problems are there, hormones are not good, and you are not having a cyst in the ovaries. That means eventually, maybe in the next 6 months, your ovaries will start developing cyst if the hormones are not adequately in balance. Then what is the treatment for the polycystic ovarian disease? One is the routine medical checkup. Definitely, you have to meet a doctor, and accordingly, you have to start your plan of treatment. The other important factors are lifestyle changes, exercise, eating healthy food, which should be there should be plenty of fresh fruits and vegetables, and stress management is very important. So we all know that prevention is better than cure. So how do we prevent before the damage is done? So as I spoke to you, this is a condition which is a lifestyle condition which can be modified, which can be stopped before the damage is done. So we need to change our lifestyle, change our eating habits, avoid fatty food or junk food or packaged food as much as possible. Wherever you can have an opportunity to eat fresh, whole grains, fruits, vegetables, we should not miss that opportunity. Always start the day with a healthy breakfast, and it should be very rich in proteins. The breakfast is the first meal of the day. It should be always rich in protein so that you can have adequate amount of energy throughout the day. So when we wake up in the morning, our thyroid hormones require food to start the metabolism. So here, if we are not eating breakfast, what are we doing? We are not giving food to our thyroid, which is responsible for the metabolism. That is why the metabolism goes into toss in this PCOS patients. They pile up lots of weight, and even in the afternoon, you are taking a very healthy meal. It is not going to do any good to you. So please remember, you have to start the day with a very healthy breakfast and have more amount of vegetables, fresh fruits and whole grains, nuts and fish. Whoever can take that, it is very good for omega 3 and also a good amount of exercise. So this picture I have specially put here because most of the adolescents and younger adults, they are into this way. They are lots of television while eating, while you are viewing the television, and just taking junk foods and all. So which is a food fad, you all know about it. So we want to replace that photograph with this, which is fresh, healthy. We have to inculcate the habit of healthy eating, fresh eating in our children. Only then and only then we will have a group of healthy individual young adults in our country. So it has to be importantly inculcated in all school curriculum as well. I feel that healthy eating should be promoted. Then this is a very common feature you can see in every household now. Children do not play, they are doing video games and mobile. Even in the garden, I see children are not playing, they are sitting in the garden and watching mobile. So I feel very sorry about that. We need to change this from the virtual to we have to come to the real one. So please try to do some real physical activity, even for the elders and those who are in 30s and 40s. Go for a walk, go for swimming, cycling, have any kind of hobby which makes you happy. It will not only improve your body tone and metabolism, it will also help you to reduce your stress level. If you are doing even half an hour of any kind of activities, our stress level goes down a lot. Have some kind of hobbies, and exercising always uplifts the mood. The PCOS patients also have lots of mood changes and irritability because there is a change in the hormones. There is an imbalance in the hormones. So most of them comes with irritability, mood changes, anger, not able to manage in their with their colleagues or in the family. There's lots of problem with the mother. So these are the things which is something we need to understand. Okay, this is the problem which is not the child is not doing on her own. There is some kind of metabolic disturbance, or some kind of emotional problem is going on. We need to give them a listening ear so that the child or the adult should talk about their condition. So it's very important because it's not only a physical problem or a menstrual problem. There's lots of psychology attached to PCOS. And then depression is also becoming very common in these people. They have tendency of gaining weight. There is a body image changes in these people. So the self image creates a lots of problem and thereby cause depression and anxiety in these group of individuals. So swap late nights with early rising. This already everybody knows the importance of early rising and how it affects our health. So we need to change this habit. From this to we have to go back to our original form. So I will just say that there are high fives in our life which we can inculcate in our habits so that we can reap the rewards, like eating right, exercise, weight loss, stress reduction, and sleeping well. These are basically the five high five of our life which can change a whole uh, health parameter of our health, and it leads to lots of stress relaxation and happiness for all of us. So with this, I will conclude. We should all take a charge of our own health, change now for a healthy future. Thank you.
Thank you so much, Dr. Sinha. That was really, really enlightening. And I don't know, but it appears as if I have most of those signs and symptoms that you showed, that probably are leading to insulin resistance, though I'm nowhere in that reproductive age group. But fatigue and the abdominal gaining of weight, etc., everything seems to be there. So, but yes, I do agree that exercise is important. Before I hand over to Khushbu to introduce Sakshi, I just had a couple of very quick questions. One is, does environment play a role in this? And is there a geographic predisposition? So, do you see more patients of PCOS in a certain geographic area, say the north, south, east, or west? And has the diet, does the diet play a role in it? And the second question is, we also hear of cysts in patients with endometriosis. And how are these two cysts different, or are they different at all, or are they the same?
I will answer the first one first, but second question I did not understand the whole of it. So just let me clarify. Geographical position has no role in developing PCOS. It is entirely a lifestyle thing. That is the reason it was initially a disease of Western countries. It was very common in Western world, and this been diagnosed in 1823. And in medical books, it is written that this is the disease which was known as a Steen-Leventhal syndrome in 1823. And even when we read about not for India, because this is something which the Western people and the Western lifestyle creates a problem and it leads to this. 2 decades, the thing has changed in my practice. When I have started my practice, I hardly have seen any patient of PCOS. But in the last 10 years, I have seen enormous amount of patients who have developed PCOS. And now I can say that every 1 in 5 patient of mine are having PCOS. So there's a huge change of the Western lifestyle which we have inculcated in our lives. So that is creating a problem. The stress factor has increased a lot, maybe whether it is a school going girl or office going ladies. Everybody is having a tremendous amount of stress. Nobody is sleeping in right time. Them have a habit of getting up early, but if you don't sleep in right time and get up early in the morning, you are creating more problem. Your all body goes into an inflammatory process. It is not rested properly. If you are sleeping at 12 o'clock and getting up at 4 o'clock or 5 o'clock and then rushing to the office, so when the body is not getting minimum 6 hours sleep, you need to have 6 to 7 hours. 7 hours is the best what we can give. But if we are not able to manage, at least 6 to 6.5 hours sleep is very important for every adult. Otherwise, the body's metabolic function is disturbed. There are lots of inflammatory process which starts. Initially we are not aware ki what is happening in our body. It may start with a little bit of fatigue, little bit of headache, and over the period of time then we are in for major disorders. And that is why not only PCOS, you can see the cardiovascular disorders have increased, the stroke has increased. Young children, young people are having hypertension. 19, 20, 21 years people are taking hypertensive pills. 14, 15 years old becoming diabetic. What is this? This is entirely shows that we are into a wrong way of living. So we have to revamp. And I tell my patients, eat what your grandmother or grandparents ate. You will never have a PCOS. Just go back. You don't have to take any medicine. Go back to your parents and grandparents. Ask what how they led their life. The amount of physical activity our grandparents were doing, the amount of food which were very natural, organic, they were taking. Just follow that routine. All your, I think 70% of problem of this generation will be just taken care of. You will not require doctors and medicines and the hospitals. It is very sad to say that people who are working nowadays, young individuals, they are doing so much of hard work for 14, 15 hours working in the office and then commuting so much. They are not having good meals, homemade food and all. So just to earn that much amount of money. And then again, when you lose your health to gain the money, and finally again you spend the same money to gain back your health. So I think this is a bad mathematics. So we should not in first place earn money with losing our health at all. We have to preserve our body, we have to preserve our health, because this is the medium with which we have to serve and we have come here to do. And just running after money, earning money and spending the same money to gain back the my own health, which will definitely not as you were born. So all of us are born healthy, but with a wrong lifestyle, wrong thought process, we land up in all this kind of health issues. So definitely it has to be taken care of. And as I have given lots of information about the diet plan also, if your second question is about diet, so definitely diet has a very important role, and we need to discuss with the doctor as well as the nutritionist. A person who is coming from suppose south, I cannot say that you don't eat rice and you go for rotis. We have to respect and understand what kind of food that person has been eating throughout her life. According to that, we can make a tailor made diet plan which will suit her, and then she can follow her also. Otherwise, what will happen if we have a uniform dietary plan given to everybody? Many of them will not, and that is what happens. He cut off on rice. That people say that rice is bad, but rice is bad. You see, from so many hundreds of Indians have been taken rice, and everybody was healthy. What has changed? The change has been hydrogenated oil, change has been all kind of packaged food, all kind of fast food, colas, aerated drinks, and to add on, there is alcohol and smoking has added to this new generation. So these factors were not, they're just cutting on the good old rice is not going to help us. We can eat rice in moderation. In fact, I can say anything which is locally grown, you can have it seasonal fruits, seasonal vegetables, rather than going for a packaged and frozen kind of thing. It is important go for the local produce. You will never fall sick. So this is important.
Completely agree.
Otherwise, there are lots of misinformation throughout. Don't eat this, don't do that. Nothing helps.
Thank you, Dr. Sinha. I completely agree with that. And I think the entire generation, at least two generations, need a little bit of introspection in how they are leading their lives and managing their lives and change it completely. I do not want to take too much of time from our second speaker. And to be able to introduce her, I would like to first introduce my colleague Khushbu, Khushbu leads a women health division in the Patient Academy for Innovation and Research. She works with all the patients and patient groups. So, Khushbu, over to you to introduce Sakshi to us.
Thank you so much, Dr. Ratna, for calling Sakshi on the platform. I would like to introduce Sakshi. Uh, Ms. Sakshi Lamba is herself a PCOS warrior, and she is also working as a HR consultant and at Bradford Consulting. So over to you, Sakshi, for sharing your journey, and we would love to know like what were the experience you had and what were the challenges that you faced. So over to you.
Thanks, Khushbu. Very good afternoon, everyone. First of all, I would like to thank the Academy for organizing such an insightful session. Ratna ma'am, Vandita ma'am, thanks for sharing valuable information with us. Like, it will really help the youth to understand better about this lifestyle disorder. So, when it comes to my journey of PCOS, it has been a roller coaster ride for me. My period started when I was in class 7th. From the very beginning, I am facing irregularity in my periods. Like when I used to tell my mother that I skipped my period this month, she said, like, this is very common in your age. So that's it. And then what happened? I got my period and it continues up to 13 to 15 days with excessive bleeding. So we visited a doctor. She just gives some medicine to stop the bleeding fast. Then I gone through some tests, and the doctor said it is because of the hormonal changes in your body, and it's very common in your age. I was putting on weight. My skin used to prone to acne, and then hair growth on all over the body, along with the facial hair. Like frustration, and anxiety became a part of my behavior. I developed self doubt towards my appearance. Sorry. So after being medicated, it was all normal till 6 to 7 months, and after 6 months, it happened again, and then it became regular. Like after every 6 to 7 months, I used to have a month where my period continues up to more than 12 to 13 days, and at some point, it got worse. Like I keep on bleeding straight for 28 days. So
Mm.
I visited n number of doctors as per the recommendation. I have taken Ayurvedic, homeopathic treatment, but nothing helps. Then I diagnosed by PCOS. I asked the doctor, like, is there anything to worry? Is it curable? A lot of questions are storming in my mind. She said, you may have complication while conceiving if you won't take care of yourself. So focus on losing your weight and change your lifestyle. Things will automatically get better. At that moment, my thyroid was on borderline. My blood sugar level was too high. She said, if you won't cure this, like you may have diabetes in upcoming 2 to 3 years. So me and my family got really worried, and as a result, I researched a lot about what is PCOD, what is PCOS, how it may affect my body, what are the symptoms, and like reading n number of articles. In the end, I found there is no particular treatment for PCOS other than improving your lifestyle. Like doing exercises, eating healthy can make your PCOS least effective only. So after that, I immediately rushed to the gym, like, changed my diet, lose almost 6 to 7 kgs, and I realized it's working. For a quite long time, my periods were regular. Changing my daily routine was actually visible, as my health was getting better. But as Dr. Bandita said, nowadays we all are pretty much stuck in 9 to 5 work culture. So we used to prioritize our work over our health. Whenever I neglect my health, it always backfires. Like in a recent time being, I was taking everything literally casually, eating junk, skipping cycle and whatnot. And it backfires. So I skipped periods for straight 2 months and recently got 2 menstrual cycles completed within a span of 10 and 15 days. So I guess I need to pull up my socks again and to be back on the track. So now I'd like to conclude. I really appreciate the efforts of their academy. Kushbu has been really kind throughout this discussion. Thank you so much.
Thank you. Thank you, Sakshi, for sharing your journey.
Thank
I just had a couple of questions. So you were advised to lose weight and to bring your diabetes and under control.
Yeah.
Also, you talked about thyroid, etc. Now,
Hmm.
this is the advice that the doctor gave you.
Yeah.
So once the person comes out of the doctor's clinic, in the day-to-day life, there is no support that is given.
Yeah.
So did you search for this kind of support in terms of counseling or patient groups, and did you find anything? Not just in India, but globally or any other place where you could discuss really the challenges that you were facing?
No, actually, no. I haven't seek any sort of counseling, and even though my family was there for me, my friends are there. They are ready for the moral support, but not in the terms of medical counseling. I I was not able to seek any counselor who can help me throughout those days. Like, what should I eat? What should I do? The doctors suggest like what you can do, lose your weight, eat healthy. But yeah, as you said, there is no specific search or where I can stop my search.
Okay, thank you. Thank you so much. So, as a follow-up to that question, Dr. Sinha, how do you think we can support patients more? Because this is not something that stops with a visit to the clinic. It has to continue on a day-to-day basis. And fighting obesity is a very difficult challenge. And we do know that even though you might be motivated to start an exercise program, keeping up with that exercise program needs a lot of motivation, even for the most motivated individuals. And how can people be supported when once they are advised from the doctor that you have to join maybe a physical exercise program, you have to manage your diet. We do not have any system in the country where there is a regular follow-up with the patient. So how do you think we can establish that? And do you think many people like Sakshi can come together and work on this, or do you think a more institutional support will work better?
See, as we all know now, PCOS only medicines are not going to cure, because definitely there is no cure to this. As diabetes doesn't have a cure. Same thing is here with PCOS also. It doesn't have it. Any kind of lifestyle disorder can be checked with lifestyle only. And I could tell that I clinic, which is the first clinic in Navi Mumbai, which where we take it as a holistic approach. Only giving medicines are not going to help. So we have to have a team approach wherein we have to have a nutritionist, psychologist, physiotherapist. Together we can make a multi-specialty team wherein I can tell you what I am doing for my patient, because I am running my PCO clinic for quite some time, and seeing all these problems, whatever Sakshi told, I see these cases every day. I will share a story of one of my patients. She was somewhere around 21-year-old girl, came to my clinic, and she was short and she was obese, and she said ki I am suffering from PCOS for the last 5 years, and I have been to various doctors and everybody has told me the same thing: you have to live with this condition, there is no cure of this disease. And finally I am not getting my menses, and she had stopped her studies, she went into depression, she was on certain antidepressant medications. So during my first visit to me, I had a discussion with her, almost 40 minutes discussion I had to understand how she is feeling about it. In this group of patient, we need to give them lots of time, which may not be possible for many doctors practicing here in our country. They may not give around 30 minutes or 40 minutes in one single patient. But the thing is that this kind of patients require time. We need to sit with them, we need to counsel them, we need to understand their problem. And after that 40 minutes discussion, she cried a lot in my clinic. And then finally I told, okay, don't worry, you go and come along with your mom. Because she was saying कि nobody understands my problem. Everybody is saying weight loss karo, diet control karo. So what should I do? I am into total kind of an emotional mess. She has left her studies and everything. Then next, after 2 days, she came along with her mom. Then I told her mom, it's not that she has to fight alone. We all have to hold her hand. As a doctor, I will guide, I will give her whatever best possible treatment and whatever is we can do it medically. But then as a mother, you have to support her emotionally when she is at home. It should not be like this that the child becomes depressed, she has a suicidal attempt or anxiety or all those kind of things. So we need to understand that this is something the body is going through. It's not that the person is just doing on her own to create a problem in the home. So then what we did, we made a proper tailor-made program for her. And I told her, you do this amount of exercise, and what exercises has to be done. That also we told. This much amount of exercise this time, and then a proper dietary thing, and then regular counseling with our psychologist and a counselor. So, and she followed everything so well. In around 1.5 years, she lost 17 kgs of weight. And then her self-esteem came back. She was very happy. She, I mean, rejoined her study. She got an opportunity to go to New Zealand and for further higher studies. And her life changed from there. Her whole family came to my clinic and they said, ki, ma'am, this was not done for the last 5 years. She was so upset and depressed. How did you do this? So that one case I can say, and we were constantly in touch with her. Whenever she was having an emotional upset or something, she used to contact us, and we have a helpline for them. So they can write their messages in the WhatsApp group. And whenever I get a time, I used to connect and reply to them. And that is how we pulled her out from that. So the need of the hour is not only the doctors, we need to have a proper support system wherein all of us has to connect with them. And definitely along with this, we should have other PCO patients so that they should talk to each other and motivate and understand from each other's journey. So there are lots of stories. I can say that many of them have conceived and now having children, and many young girls were going through this, around 9 standard students. And I had one patient who was bleeding profusely for 1 month, and she had to appear in her board exams. And one night her mother carried her and brought her, she is bleeding so profusely, how she will go and attempt her exams and all. So there were lots of things. So somewhere along with the medical management, we have to give them a little personal attention. A little softness should go along with it. And whatever is said and done, if we are very strict with all these exercise, diet and everything, so I don't find why it will not be controlled. And definitely we need to make them understand ki, see, now when you have changed your lifestyle, you are doing a certain type of exercise, diet and everything, so please don't go back to your original phase again. Otherwise, this will again come back. So that is the mistake what people do. Once they lose 7, 8, 9 kgs, they will leave the exercises, they will start eating everything. You can have cheat diets. I don't say you have to be very strict in your diet throughout the life. That will again create a depression. So we have to understand how to balance. Suppose I ate something today which is very high in calorie, so another 2 to 3 days, how I have to balance my diet so that my weight should not increase. What amount of exercise I have to do. But all these things should be done under a proper guidance. I will again give you one example of one of my patient who was very obese, 19-year-old. I said, ki, since there is PCOS, we have to work out. We will start working, lose weight. So when we said that you have to lose weight, and she immediately next day onward, she went to a gym and started doing gymming. In a month's time, she had a spinal injury because of wrong exercises done in the gym. And then one full bedridden. And then her parents came and they said, Ki, my daughter is not able to walk. There is a problem there. And the doctor has advised for a spine surgery. Otherwise, she will not walk. Then I was very worried for her. I said, see, if the person is overweight, 80 kgs, 90 kgs of weight, and you simply go and start running on the cardio machine, or you start doing heavy exercises, the people who are in the gym, they are not doctors. They have to understand your body, your anatomy, and how much work you can do, and what will cause a damage to your knees, to your ankles. So you have to understand. So it is very important. We need to have a graduated exercises which a physiotherapist can do, which a yoga specialist can do. So once your body is toned up, and then you can do exercises in gym. The first activity, if the teenagers go and start gymming, there are other repercussions also. And that was a learning lesson for me also. And from that day, I never tell anybody ki you have to lose weight. And I usually tell them we will lose weight, but we will start like this. And then I give them a plan. You first do this, you first do this, and then if your weight becomes this much, then only you go to the gym. 80 kgs, 90 kg, who has never worked out any time in her life and suddenly goes for a gymming, it creates them than any kind of help for them. So that is another word of caution. So anything which, do not overdo anything if your body is not permitting, because it's not only your ovaries which are in trouble. If the spine goes, if the knees go, you will be in a major problem. You will not be able to walk. You will not be able to stand. So we need to respect our whole body and work in a totality, not in one particular part. Ki my tummy is very heavy, or mujhe tummy se weight loss karna hai, do abdominal crunches, and then your spine is gone. So we need no, or your cervical spine is gone. Many times people develop cervical spondylitis and all those stuff when they are doing crunches in a severe way. So we have to have a tailor made program, whether it is exercise, whether it is diet, or whether it is our medication and all. So it should be individualized. Then and only then we will get an adequate result. And once they start showing us good symptoms, we stop the medicines altogether. I don't prefer giving medicines for long. And then I try to manage them with only lifestyle management and teach them, you see, this condition is going to stay for your life. You have to learn to manage it with lifestyle and not with the medications. Medicines and supplements are there for some point of time. When things become very aggravated, we can bring back the periods, we can do everything. But overall, you have to learn how to manage with a lifestyle change, so that you can have a healthy lifestyle, and you can push back this diabetes back also. If your lifestyle is very good, it is not mandatory that you have to have a diabetes after 10 years or 15 years. You may not have diabetes. And on the other hand, these patients are very much prone to have endometrial cancer as well. PCO patients, if they are not treated properly, when they reach 50, 55 years, 60 years, they come up with endometrial cancer. And that is why we need more awareness. It's not only menstrual irregularity, it is your whole health, whole reproductive life. And then later on in the old age, there are other bad things waiting for us. So it is very important. The awareness is one thing which we have to do in a larger scale. We can feel that. So only that will create awareness, and people will seek right advice from right people.
Thank you, ma'am. That is very, very comprehensive what you just said. And the key takeaways that I get from you is that probably some guidelines that can be shared with patients in form of written pamphlets, booklets, etc., or a video would be very helpful. And I look forward to support in creating those kind of awareness materials that can be disseminated to various patient groups. Also, most people who suffer from obesity and PCOS do not understand that it is a lifelong disease, and most think that it can be cured with medication, which is not true. It needs a lot of commitment and a lot of investment from the person's side, not only to manage their lifestyle and diet and other conditions, but also to be able to stick to that plan so that they don't come back to the same state that they were in after a short gain. So thank you so much once again. Thank you, Sakshi, for joining us today. And I hope to be connected to both of you because I learned so much in this 1 hour session. Hearing from you, Dr. Sinha, I think there is a huge need in the context of our country to raise awareness. And perhaps we need to do it in a much more stronger way than what is being currently done in terms of a massive awareness program. So I look forward to being connected and to carry this wonderful work that we started today forward. Thank you everyone for joining us. This session was live streamed on Facebook. It will also be available as a recorded session for those who would like to watch it later. So thank you again for joining us today, and we hope to stay connected. Thank you.
Thank you. Thank you so much.
So much, doctor.
Thank you, everyone.
Thank you.
Thank you.
Thank you. Bye.